Sarcopenia refers to the progressive decline in muscle mass and strength with age, and is prognostic for mobility disability and chronic disease risk. To prevent or delay sarcopenia and to maintain functional abilities and reduce chronic disease risk, it's recommended to maximise muscle in youth and young adulthood, maintain muscle in middle age, and minimise loss in older age. Although resistance training is recommended in the current physical activity guidelines, the primary message is to accumulate at least 150 minutes of moderate to vigorous or 75 minutes of vigorous aerobic exercise per week. However, resistance training is particularly effective at improving muscle mass and strength, and it's now becoming recognised that resistance exercise training can be just as effective as aerobic exercise in reducing chronic disease risk, contributing to enhanced physical function as we age. To demonstrate resistance exercise training can be a primary countermeasure to age-related chronic disease, the article, published in Frontiers in Physiology by Jonathan Mcleod and colleagues, reviewed the evidence showing the beneficial effects of resistant exercise on combating chronic health disease, including type 2 diabetes, cardiovascular disease, and cancer, and in doing so, put forward recommendations for older adults. This presentation, brought to you by Talking Sports Science, will be a summary of their research. Firstly, regarding type 2 diabetes, which is high blood glucose levels due to the pancreas not making enough of a hormone called insulin, with insulin's role being to allow glucose in the blood to enter cells, providing them with energy to function, or what insulin the pancreas does produce not being used by the cells properly. When this happens, it's known as insulin resistance and can also be referred to as having a low sensitivity to insulin. The loss of muscle mass and metabolic quality with aging, along with reduced physical activity levels, contribute to the development of type 2 diabetes. Lifestyle interventions, including diet and exercise, are arguably the most effective strategies to prevent and manage diabetes, with resistance training playing a crucial role. The muscle contractions involved in resistance training can improve insulin sensitivity, independently of changes in lean body mass. Furthermore, when older adults perform regular resistance exercise, it can lead to an increase in mitochondrial oxidative capacity, which simply means an improved ability for muscle to use oxygen, and is likely linked to the training-induced improvements in insulin sensitivity. Moving on to cardiovascular disease, which is an umbrella term for conditions that affect your heart or circulation. Resistance exercise is often overlooked when it comes to reducing cardiovascular disease risk. However, resistant exercise has been associated with improved blood pressure, blood lipids, insulin sensitivity, and improvements in vascular function to the same degree as aerobic exercise. For example, the Women's Health Study revealed that women who participated in 1 to 2 hours of either resistance exercise training or aerobic exercise training per week experienced a similar 22% reduced risk of developing cardiovascular disease. And because resistant exercise can lead to significant reductions in blood pressure, it may serve as an addition or alternative treatment to antihypertensive medications. The beneficial effects of resistant exercise on cardiovascular health extend to individuals with type 2 diabetes who have a 2 to 4 times higher risk of developing cardiovascular disease compared to non-diabetics. Despite the associated benefits, clinical prescription of resistant exercise training is often rare, primarily because aerobic exercise training is perceived as safer for patients with cardiovascular disease, due to concerns that resistant exercise may induce high-pressure loads on the heart, leading to a mild form of cardiac hypertrophy, which can increase mortality risk. However, excessive elevation of blood pressure is primarily associated with high-intensity resistant exercise training, for example, above 70% of 1 repetition maximum. Therefore, low to moderate intensity resistance training, for example, between 30 to 69% of 1 repetition maximum, is recommended, and is considered safe and effective even in individuals with cardiovascular disease, or at risk for developing cardiovascular disease. And regarding cancer, which is a major global health concern, with millions of new cases and deaths each year, many cancers share risk factors linked to type 2 diabetes and cardiovascular disease, and are associated with a sedentary lifestyle. This is supported by the fact that regularly performing both resistant exercise and aerobic training is associated with a reduced risk of developing cancer, dying from cancer, and improving cancer prognosis. However, future randomized controlled trials are needed to determine which exercise modality is most effective. Current therapeutic approaches for cancer often exacerbate muscle loss, impacting vital clinical endpoints like cancer mortality and disease progression. Therefore, resistance training may help to alleviate some of the side effects of treatment by helping to preserve muscle mass and strength. For example, whole body progressive resistance training, using between 2 to 4 sets at 60% of 1 repetition maximum, has been shown to preserve muscle mass and strength in patients with prostate cancer undergoing androgen deprivation or radiation therapy, and in breast cancer survivors receiving adjuvant treatment. Whole body progressive resistance training, using 3 sets at between 60 to 70% of 1 repetition maximum, improved lean body mass, strength, fatigue, and chemotherapy completion rate. A number of mechanisms have been proposed to mediate the protective effects against cancer, including improved insulin sensitivity, body composition, immune system function, and markers of inflammation, which are all factors linked to cancer risk and progression. Skeletal muscle release small proteins called myokines into the bloodstream. These myokines have anti-inflammatory and insulin-sensitizing effects on adjacent tissues. Therefore, since obesity, insulin resistance, and inflammation are associated with cancer, exercise-induced myokine secretion may support anti-cancer effects. However, the exact relationship between resistant exercise training and myokine release is not well understood, and their potential in combating cancer requires investigation. And regarding general resistance training recommendations for reducing age-related chronic disease risk, older adults can use either body weight or conventional resistant exercise by adopting a progressive whole-body approach, performed 2 or more times per week, and because older adults often avoid resistance training due to fear of risking injury from lifting heavy relative loads, as mentioned previously, light to moderate relative loads, for example between 30 to 69% of 1 repetition maximum, are recommended, as they are just as effective for providing health benefits. And because exercise volume is seen as a more important variable than exercise intensity, performing a high number of repetitions to volitional fatigue is recommended to reap the beneficial effects of resistance training on reducing chronic disease risk. The key take-home message from Mcleod and colleagues is that resistance exercise should have a more prominent position in exercise guidelines, particularly for older persons. Nevertheless, when it comes to slowing declines in physical function in older adults, a multi-component exercise program consisting of resistant exercise training, aerobic exercise training, and balance training are likely the best strategy. And that concludes this presentation. I recommend you go and check out the full article. The link is in the description. Thanks for listening, folks. See you next time.